Hello, Stephen Hayes here. I'm a skin cancer doctor from the south of England, and I want to talk about the diagnosis of basal cell cancer. Now, this is the most common of all skin tumours. About 1 in 5 of us will get one. Thankfully, they're slow growing, they don't spread through your body, and they are completely curable. Not to be confused with the melanoma. Comparing a basal cell cancer with a melanoma is like comparing a grass snake with a black mamba. Both snakes, very different outcomes. They present usually as a little papule, a little blob, which is usually pink, and it slowly gets bigger, and eventually it will ulcerate. It will form an ulcer like this one by the nose. These, when you get them right next to the nose like this, they can be quite difficult. They need to be treated properly. Here's another one. This was a slowly growing lesion on somebody's arm. A relatively young person, wasn't diagnosed immediately. You shouldn't have a slowly growing, unexplicable lesion, especially one that ulcerates. Here we see this one is quite big. It's mainly flat. This is a superficial basal cell cancer, scaly, and it's a little bit scabby. On the ear, you'll get them sometimes. Again, we see a little papule, a little lump with an ulcer in the middle. They don't always ulcerate early on. This typically presented with a scab that never healed. That's often how people come along with a basal cell cancer. So they've got a little scab, never healed up. This is on somebody's back, a slightly funny looking area here that is a bit pink and white, a ring of dark spots down the right hand side. The dermoscope makes these much more visible. These are more typical sort of basal cell cancer type of pigmentation. You see pigmentation in about 20% of all basal cell cancers, and more typically they present like this, an irregular, slowly, steadily growing pink lump. If you've got a pink lump that came up over the last week, it's probably a pimple, but if it's come up over 6 months to a year, it may be something else. Again, this one is on somebody's forehead. About half of all basal cell cancers are on their head and neck. And this is a dermoscopic picture of the same image showing these typical blood vessels. More about that later in another video. And these irregular blue-grey blobs. Another typical basal cell cancer. It's a pink lump with prominent blood vessels, solitary, slowly growing. You know, the smaller these are, the less trouble it is to cut them out. Here's something that's ulcerated, definitely. You could call this a rodent ulcer if you like, but I prefer not to use that term. This was another basal cell cancer. It's pink and it's ulcerated. This was a pigmented basal cell cancer. You can't tell that from this picture, but what you can tell is that there is an irregular looking something that should be investigated. Sometimes you get them behind the ear. Here again, it's a nondescript nodule with an ulcer in the center of it. This next lesion was reasonably big, as you can see from my finger, which, by the way, I hit with a hammer earlier. Slowly growing over several years, mistaken for eczema. This was, you see what there's a white scar here, bottom left-hand corner. This basal cell cancer had been scraped off and had recurred. That's not a very good way of treating. Better to cut them out cleanly. This one's about to be cut out. You can see a flare around it of local anaesthetic. This another typical basal cell cancer. This was quite a long history here, several years, slowly growing, red patch. Again, somebody thought it was eczema, but it didn't respond to steroid. Basal cell cancer. Again, irregular, pink, slightly scabby. It's got to be something. A good chance it's a basal cell cancer, and it was. Here's another one, a bit more elevated. You can see somebody got lots of harmless little warts around that. In the middle there's something that's pink and brown, and it's got these irregular blue dots in the middle. Another basal cell cancer. Strikingly abnormal looking thing on the back. Now, on this view, this could be a melanoma, so you'd want to hurry this along, but it was a pigmented BCC, and it probably take 5 years to get that big. Watch out for your back. You know, if you have someone to look out for your back, that's a good thing. Often the tumours don't reveal themselves until they bleed. Big lump, could have been a squamous cell cancer. You can't tell with this. A lump that's pink and white and ulcerated, but it was a basal cell. Chop that out. Often in the elderly living alone, they let tumours get bigger than they ought to. You know, when you're elderly and you're frail, you've got lots of other things to worry about. Sooner we can see these, the better it is, the easier it is to cut them out. And this was a young person in their 20s, and this took a few years to be diagnosed, even though it's got typical raised edge and a central ulcer. Okay, so that's just an idea of what basal cell cancers look like. Thankfully, they are nearly 100% curable by surgery.